All right. Hello, everyone. Dr. Evan Katz here, Katz Chiropractic and Digital Motion X-ray and Rehabilitation Clinic in Boulder, Colorado, where I practice with my wife. So I want to go over conversation that I was given permission from the patient that has been suffering for 8 years and has spent out of pocket approximately $1 million for neck issues. Now, sometimes that could be reasonable and necessary, right? Surgeries and other things, but she didn't have surgeries. And really, a big chunk of it came down to a provider saying it was C1 and the amount of treatment that she had and the costs relative to what I saw on the image. Now, I am not here to say that these providers were correct, they were wrong. This is her words. She said I could use her name and I have her recordings. And I want to show you the imaging because a big part of why she reached out to us is we did 2 digital motion x-rays. We did a first one, then we did a second one, never treated her. And the providers, according to her, after the second DMX said that I didn't do it correctly. I think it's because they didn't get the results that they were hoping to see. But I want to show you what the images actually showed, how I interpret them, and anyway, you'll see. So I put together a little something, hope it all comes out well in terms of sound. So take a listen. So this patient spent $1 million on neck care. The first chiropractor that she saw for years said it was not her neck, it was her eyes, because her eyes will cause her neck to buckle and function inappropriately, which I don't know, maybe that's true. It's not anything that I've ever seen or have necessarily witnessed in the literature. Maybe there is, but ignored the imaging according to her and said it was her eyes. So take a listen to what she says here, and you'll hear from her own words of what was said, and then we're going to go over some imaging.
Crosby saw, so I went to see him in Florida from Canada, and they told me that it wasn't my neck, that it was my eyes from the brain injury. So I chased that for 8 years working with them. I basically lived in the States for 6 years trying to get my vision back online. And then year 8, I finally realized that it was my neck.
So you're telling me that for 8 years, you've had all this imaging and no one has talked to you about the shape of your neck, even though on every imaging, I bet you if you go back to your imaging of your neck. So she is out $970,000. She saw online, this chiropractor helped this person, and they went for 8 years with, according to her, little to no improvement, and kept telling her it was eyes and concussion. Now, it is almost impossible to suffer a concussion without having a neck injury as well. So if they were saying it was a concussion, but no one looked at her neck or ignored the findings on her neck, it's not totally what I do. So let's move forward here. So here's another video. Listen. Right? And again, sorry, told not her neck. Listen. So you're telling me that for 8 years, you've had all this imaging and no one has talked to you about the shape of your neck, even though on every imaging, I bet you if you go back to your imaging of your neck, I guarantee you the radiologist said you had a loss of the cervical plate.
I think, Dr. Kent, that's exactly what I'm saying, and to the point where when I had this DMX in 2018, I sent it to every doctor.
So she had images of her neck. I'll show you the findings that were on there, the measurements, the established normals, and she's outside the established normal. And most of the providers only looked at one bone in the neck where multiple bones were a problem. Now, there are some chiropractors that will argue that the reason that the rest of the neck is a problem is because of C1. I published papers fixing C1 without ever touching C1. And there's tons of evidence to suggest that as well. Now, C1 problems are a problem. that need to be analyzed. But is everything always because of one bone or one issue? No. In my opinion, and in my clinical experience, and as well as some of my publications. So she's been seeing people, they've gotten images. The images have showed problems, and she was saying that none of them analyzed or even discussed with her the structure or stability of the rest of her neck. So here was her initial static image from the DMX that we took in 2018. And then after tons of care, 2024. Her curve has gotten worse. She has more degenerative changes here now compared to here because the kyphosis is getting worse, and so is the CSVA, which is going to continue to put Atlas at an abnormal plane. So this, you can see the research that we know and have shown that an abnormal curve will lead to more degenerative changes, can put irritation on the spinal cord. They never talked about it, never addressed it. And her neck, the curve and the shape has gotten worse. And you can see how her normals have gotten worse. Now, one of the things that we showed and what one of her providers apparently told her was that, oh, the DMX wasn't done right because you're not extending as much. But I'm going to show you what actually happens is she can't extend as much. And she's getting more what appears to be skull base extension. Why? Because she has now a worse curve. And because of the worse curve, more degenerative changes, and more degenerative changes leads to hypomobility. So because they only address C1, and now her range of motion is less, intersegmental motion is less. So you could have a problem with instability too much or too little is hypomobility. She has more hypomobility, worsen of a curve, and increased degenerative changes. And we actually just published a paper showing how we can reverse degenerative changes by improving the curve because of what the physiological aspects on the discs are. So it's not that she has muscle spasms, why she can't move, as apparently one provider told her. No, it looks like the loss of curve was ignored. It was never tried to be improved. When the loss of curve occurs, it's putting more pressure on the anterior column. The anterior column is putting pressure on the discs. The discs are creating apoptotic cells. You're increasing degenerative changes. You're increasing fibrosis. And now you're having less movement in the mid-neck. And now the upper neck is having to compensate even more. Now listen to this video. So you're saying year 8, you saw Dr. was just analyzing C1, and then he sent you to some kind of injections. How many injections did you have on your upper neck?
And then he adjusted me and said, Marianne, once I adjust you, if you just stay in alignment, you'll get better. But I never did. I was just getting worse. And then when I rang him and told him, he said, okay, go back and go to 2018. And I got injected from C0 to C6. And he said, well, go do it again. You need to change. That's what you need to get better. So just addressing C1, saying C1 is going to, if we continue to adjust it, the rest will get better. That has not been shown to be the case with her pre and post on those images and on the DMX that they were referred back. The DMX was done correctly, measured appropriately with measurement tools, computerized radiographic mensuration analysis, and it was done the exact same way the first one was that it was relied upon. Now, just because your treatment fails doesn't mean it's not effective. But when you say that, hey, if we just adjust one thing and everything else will get better, there are techniques out there that have been proven consistently to improve the shape and structure. So just because it failed, you're then going to go to a more expensive, invasive procedure of injections. And injections, there's a time and a place, of course, but this person has a structural
and functional issue in the cervical spine. And in my opinion, and how we practice, needs a structural and functional treatment in terms of the type of chiropractic care that I believe we can give and we do give in our office. So all of this was just looked at this one little spot. And the rest of the spine wasn't addressed because they said, if we just look at this one spot, that's why everything else is a problem. And she's now down $1 million. So here's my pre-post breakdown. Okay, let me just see here if I didn't go too far. Okay, so here we go. Listen to this.
Video, the initial DMX, and now here is
on the left
the post DMX after all this treatment where they ignored the curve. Now they told her that the second DMX wasn't done right and wasn't measured right. It was done and measured the exact same way as the first one and calibrated. And they said that there wasn't enough movement because of spasms. And I disagree. What you're seeing here in the post is not spasms. But the research strongly supports that when you leave and ignore the curve, you get more degeneration. In fact, we just published a paper reversing that by reversing the curve. So now what you're seeing is not spasms. You're seeing hypomobility, most likely due to fibrosis, due to increased disc degeneration, which leads to abnormal functional spinal units. And now, where's the extension occurring? Not in the mid-cervical spine, just at the skull. This is what we're talking about with this patient, and analyzing it is ignoring the curvature, ignoring the structure, ignores the function, and the function will continue to break down. And now when we do a post movement, she's getting less and less global range of motion, less and less segmental range of motion because of how this is continuing to break down and not move.
Does that make sense?